Hi again. Well, it's been a while since we've had our last video, and lots of things have changed, both here at SUMA as well as obviously nationally. But one of the things that's changed is that the CDC now has released a new list of the symptoms that we associate with COVID-19. This is primarily because as we've seen more cases, and now quite honestly, there's been over 1 million identified cases in the United States, but as we've seen more cases, we've become aware of increasing types of symptoms associated with this infection. You know, initially we thought of 3 symptoms, and those were fever, cough, and shortness of breath. But quite honestly, those were symptoms associated with more serious type of disease, patients that usually would have to come into the hospital. But now we're aware of other symptoms, and I want to show you right now what is on the CDC website. So now you can see that the symptoms include either cough, new cough, or shortness of breath or difficulty breathing. But you can see below that, or at least 2 of the following symptoms, which includes fever, chills, repeated shaking chills, muscle pain or myalgias, headache, sore throat, or new loss of taste or smell. So you could have 2 of these. For example, let's say muscle pain or muscle aches and sore throat, and not even have fever and be considered to highly have COVID. Or you could have, for example, headache and new loss of taste or smell. So these are important because as we ramp up the ability to do testing for this infection, when we see these types of patients, it's going to be important to consider these patients to be tested as well. Well, this is certainly the new look, isn't it? I'm wearing a mask here, and this is extremely important as businesses open up, is that we continue to do the types of things that have led us to reducing or flattening the curve for COVID, and that is one of these is to wear this type of mask. I'm going to take it off now because we're videoing and I'm not in the hospital, I'm not around anybody, but I just wanted to use this as an illustration because as we go forward and open up the communities and reduce some of the restrictions, it's still going to be very important for us to be safe, to do many of the safe practices that we've already been used to, such as, you know, hand hygiene, social distancing or staying away from people at least by 6 feet, sanitizing surfaces that may be contaminated with the virus. So all these are going to be very important, as well as using our mask when we're out in public and potentially around people, because the greater percentage of us that use these masks, the better it is going to be to reduce transmission of this infection. Let me make it clear that there's no evidence that food is associated with transmitting this particular infection. But certainly at home, using sanitizers to wipe down common areas that you might touch your hands with. Obviously, surfaces of countertops, doorknobs, handles of phones, etc., even light switches. It's extremely important, at least daily, we've discussed this before, to reduce the transmission because the virus could be on these areas for as long as a day or 2. So it's important to do that. As far as food, as I've already said, there's no evidence that food directly transmits this virus, but you know, other infections can be transmitted by food. So, you know, if you have fresh fruits, if you have fresh vegetables, it's still important when you get home to wash those down appropriately as you would at any time to make sure you're safe when you eat these foods. Well, right now, the recommendation, according to how we open up the community and reduce restrictions, is 10 people within a closed space or within a room. So that's not a lot of people, but this is what's required for us to generally open up the community so that we're safe. Now, as we see that we're able to maintain this and not increase the incidence of the infection, I'm sure that we're going to see that we're going to have increasing numbers that can be in a gathering. But right now, it's just 10 people. Well, right now, we're not recommending to be able to have those types of large gatherings because we know that it's spread from person to person. And even if we're using all of these devices and masks, they're still a concern. So I really can't tell you when it's going to open up that we can have these large gatherings, but it's going to be at least several months. Well, that's a very good question because we're getting to the summer months now, aren't we? And we all want to travel. We want to get somewhere that's nice. I mean, we've been sort of cooped up in our homes with the shelter in place and stay at home types of principles. Again, it's going to depend upon how things happen as we sort of reopen the communities and we see what happens with travel. I think international travel is still going to be a very risky thing at this point in time. Travel to maybe areas in the country that aren't hotspots, I think will open up sooner. We'll just have to see when the governors or the various health departments of states suggest that it's okay to do non-essential travel, because right now as we go into phase 1 and even phase 2 of opening up the communities, we're still supposed to restrict non-essential travel. Well, that's a very good question. We're concerned about that. I mean, this is a respiratory virus. We know that there are respiratory seasons. It certainly happens with influenza. So I think we have to anticipate that when we get into the winter months, next fall, next winter, that we will see an increase in this type of coronavirus. Certainly the normal coronaviruses, those that cause the common cold, we see that increased in the winter months. So I think we have to anticipate that this will happen. Now, is it going to be worse or less severe than now? I don't know, but one of the concerns is, and you may, or many of our viewers may have heard recently that the director of the Centers for Disease Control was concerned that there may be a worsening condition in the next winter because of the resurgence of COVID-19. But what he was really referring to is that it may occur at a time when we may see the normal recurrence of influenza, because we know there's a high degree of morbidity and mortality among the same types of patients who are vulnerable to influenza, who are also vulnerable to COVID-19. So it may be sort of a dual or double-edged sword that may potentially be occurring at the same time. And I think that's what he was referring to, is that if there is a resurgence of COVID, it may be a more difficult one to manage if indeed it occurs when influenza is also occurring. Because we also know you can be dual infected. You can be infected with influenza and COVID-19, and in general, when that occurs, the illness is somewhat more severe. However, there is one aspect that we can really reduce that potential, and that is make sure next fall, next winter, that we all get the influenza vaccine. I don't anticipate by the fall we'll have the COVID vaccine, but possibly sometime during the winter we will, hopefully. And then when that's available, we can get that vaccine as well.